Hello, and thank you for joining us today. We hope that by the end of this session, you will have a full understanding of your prescriber report. The Alabama PDMP began sending prescriber reports in the third quarter of 2018. No one other than the prescriber receives a copy of these reports as they are sent directly to the prescriber's email address associated with their PDMP account. These reports are sent to prescribers who prescribed one or more controlled substances in the past 6 months. The prescriber report acts as a snapshot of your prescribing history for that selected date range. Prescriber reports provide information regarding current prescribing volumes, behaviors in PDMP use, as well as the ability to track changes in these metrics over time. In no way are these reports meant to be a reprimand of any kind. They're simply being sent to give the prescriber an overall picture of their prescribing history. We understand that there are many differences in practices of the same specialty, such as number of patients seen daily and severity of patients' conditions, and these details are not reflected in these reports. Now, let's look at some specific details on the prescriber report. You will see the date the report was processed and the date range covered by the report. You will also see your name, DEA number, role in the Alabama PDMP, and the specialty you selected. There's also a section that shows the total number of prescribers who have selected the same specialty as you on their PDMP account. The next line displays the top 3 medications that were dispensed under your DEA number. The next 4 sections provide information related to your prescribing. The blue block denotes your prescriptions, while the pink line denotes prescriptions written by your peers. Information pertaining to opioids is displayed in the first section. The first graph shows the number of opioid prescriptions per patient that were filled under your DEA number during the report's date range. The second graph shows the average daily MME per patient for the same time period. The third graph shows the average quantity of the prescription per patient. And the fourth graph shows the average number of days for which the prescription was filled. At the bottom of this section, the number of patients you wrote prescriptions for in comparison to the number of patients with prescriptions written by your peers within the same specialty is shown. Next, we come to the buprenorphine section, the sedative section, and the stimulant section of the report. These sections reflect the very same information as a section on opioids, only the drug classification is different. The next section helps you identify patients who are receiving potentially dangerous combinations, patients visiting multiple providers, and patients who exceed commonly established MME thresholds. There's an enhancement that will be available soon, which will allow you to access the at-risk patient information, the names of other providers prescribing to your patients, and the names of the pharmacies that are dispensing prescriptions for your patients. This will allow you more information in your determination of addressing any issues with the patient and other prescribers involved in the patient's care. The bottom of the report shows how many times the PDMP has been accessed by you, any delegate linked to your PDMP account, including physician delegates and mid-level prescribers, and the total number of patient searches. We hope this session has explained the prescriber report in more detail and that you consider it a helpful and useful tool for you in your practice. Thanks for your time and attention. For any additional questions regarding prescriber reports, please contact your PDMP administrator at pdmp@adph.state.al.us.